Hello, my name is Dean Contover. Welcome to the Current Buzz. Today we have a physical therapist. His name is Dr. George Potamitis. Thank you for coming. We're going to talk about physical therapy. I better sit up straight in my chair because he's a physical therapist and he'll tell me that I'm not sitting correctly. So at home, make sure you sit up straight and listen very carefully because he's going to give us some information. He's going to tell us how he was licensed, or how people are licensed for physical therapy these days. Things have changed. And so thank you for coming on the show again. And we're going to talk about how you got into physical therapy, why you did this, and your education, and what is today required to be a physical therapist, quote unquote.
Thank you very much for having me. I really appreciate the opportunity to present the physical therapy profession to the public. I'm sure many people probably had physical therapy in the past, but I can give a little bit more insight about what we do,
right,
and how we can help people, improve their condition. So for starters, physical therapy is the art or science that is assessing and restoring motion of a joint, motion of a body part, or a movement pattern. And that's what physical therapists do. We really address the underlying problem of the disease. We don't try to cover it like sometimes medications do, but we try to address mechanically what is going wrong with the patient,
right,
and try to improve that. My background, I'm originally from Greece, where I grew up. I did my undergraduate at the University of Rome in Italy, where I got my bachelor's degree in physical therapy. Then I came here for graduate studies. I have a degree in healthcare management from Brandeis University Health School, and a degree in orthopedic physical therapy master's from Massachusetts General Hospital Institute of Health Professions, and a doctorate in physical therapy from MGH, Massachusetts
right,
General Hospital Institute of Health Professions.
Right.
Today, for a person to become a physical therapist, they have to complete a degree in healthcare sciences or exercise physiology for 4 years, and then they have to apply for a doctorate in physical therapy. And then that's how the entry level of physical therapists today in the United States, or at least Massachusetts, it's required to have a doctorate degree.
Oh, a doctorate degree. It used to be just 4 years or a master's degree. And when did that change?
Has been gradually changed for the last 4 or 5 years, where the profession is trying to really educate people more and more as they come in. And at this point today, as I said, you have to have a doctorate degree in order to be admitted to get the license exam.
Now, you have an office in Lowell and Chelmsford, excuse me.
Yeah.
Right, you have an office in Lowell and Chelmsford, is that right?
Yeah, we have an office in the same plaza where the senior center is in Lowell, and we have an office in Chelmsford at 110 at the Zeus building.
Yeah, okay. Can you give the address of it? I mean, in case some
Yeah,
people...
it's 278 Broadway Street in Lowell, and it's
Chelmsford Street.
227 Chelmsford Street in Chelmsford. Yes.
Chelmsford, right.
Yes, right on 110. Route 110.
Right on 110, so...
Yeah.
So why would I want to go to a physical therapist? What's the reason? Can I just go myself, or do I have to be referred by a doctor?
In the state of Massachusetts, the patient does not need a referral to go for physical therapy.
Okay.
So a patient can really show up and be treated. However, there might be some insurance restrictions. So a lot of the insurance require that you have a physician referral before you can access physical therapy. Otherwise, the plan is not going to cover it. Medicare also requires, which is a bigger, payer, requires a physician referral.
Oh, is that right? Yeah.
Yes,
Right.
prior to cover physical therapy. So the common conditions that we do is painful conditions like back pain, neck pain, shoulder, knee pain, etc. Post-operative injuries. So this is the bread and butter, if you will, of physical therapy. We treat all these conditions. We also treat TMJ patients that they have jaw problems, headaches,
What if you can't resolve a knee problem? What would you suggest that they get an operation? How is that done? Let's say knee problem. Do you get them before operation or post-operation or both?
Most of the time before any operative, unless it's something that obviously requires immediate, surgery, like a fracture or displaced fracture or anything like that, people need to have this pretty good evidence that people need to have physical therapy. Sometimes the problem gets resolved, and then if the problem is not resolved with physical therapy, then in coordination with the patient's physician or specialist physician, then the decision is made whether surgery is going to.
So that person's physician would call you and discuss it with you. Is that my understanding?
They either discuss it with us or they're going to do more testing. And they're going to evaluate the situation, and generally a surgeon is the one with the patient who's going to make that decision. A lot of times, sometimes they decide to do obviously more testing, like more specific imaging to see what is going on, and then from there they make the decision to go ahead and have surgery.
Sometimes athletes get massages and so forth. Do you have that in your umbrella? Massage therapy?
We do a lot of manual work, we do a lot of myofascial work, but we don't do what we call like a general massage therapy.
Oh, okay.
It's all under the umbrella of physical therapy. We're heads-on physical therapy, so we do a lot of manual work with all of our patients, but we don't do like a general, massage therapy.
Okay, walk me through the steps. The kid gets injured in football or volleyball, or whether it's a girl or a boy. What happens? Let's say they injured their back or knee. What happens in the procedure?
They generally, obviously they're attended by the athletic trainers that they're there from the school, and then they probably going to see their pediatrician. So the pediatrician is going to decide whether the patient needs to really go ahead and see a physical therapist or needs to go to a specialist. Our recommendation generally is, unless it's something suspected like a fracture or something that can be very detrimental to the patient, at the same time the patient is scheduled to see a specialist, to also schedule to see a physical therapist. Right. So by the time they're going to see the specialist would like to know what that patient has done up to that time. So they get the referral for physical therapy, they give us a call, and then we arrange the appointment. So the patient comes in, and then we do a detailed assessment, trying to find out what exactly is going on with that joint or body part.
Right.
And we try to give like a physical therapy diagnosis that sometimes can be a little bit different from the physician diagnosis, because it has to do mostly with mechanics.
Right.
And then we propose a treatment plan to the patient, and we explain to him and her or the parent how exactly we can go ahead and implement that plan. And then we start our treatment, and we generally reassess the patient every 3-4 weeks to make sure that we are on plan and things are getting better.
Right.
And we adjust the plan.
Right. Okay, so success rate, do you have a success rate, or is it, let's say, that's coming in probably with a knee problem, do they have a success rate? Excuse me. Do you have therapy for a cough or anything like that?
Unfortunately, this is not something that physical therapy can help you. We do have a very high success rate, depending on the condition. And that also, a lot of times, when the patient comes, most of the times we're able to really kind of get them, give them like a more accurate assessment of how much they're going to progress. Sometimes we get a patient with, let's say, a shoulder problem. In today's healthcare continuum, it's not easy to do very expensive imaging tests. So a lot of times from exam, you don't know if the patient has a total tear in a ligament, which is going to make it more like closer to a surgical kind of candidate. Right. But for a few weeks, you really have to work with physical therapy to see where you go. But our success rate has been actually pretty good. Over 60-70% of the patients do feel better. We'll be doing this now for 20 years in right. this area. I'm a therapist for 30 years, and that's another thing that we really focus on. My partner, who's also a therapist, is more 30, 35 years of experience, and both of our assistants have 20 years of experience. So we do this for a very long time. We do focus and follow up the research and the new things that they come out. So we try to really do the best we can to help.
So you do the assessment. So when the final assessment, you also do that and say
exactly.
This is the last time. Now, who do you give the final assessment to? Is there another physician, or is it another clinic, or is it to the parents or to the person?
The patient is preview of the assessment, but automatically once they do the assessment, most of the patients that they're referred to us by physicians, whether they're primary care pediatricians or specialists, automatically get a copy of our initial assessment, our reassessment every week, so every 4 weeks, I'm sorry, and our final assessment. So everybody's part of the team. We really believe that most of the patients have really benefit to really have a team working on them, and if the team is not communicating, then they're not going to get the best possible care. So absolutely, it's very, very important that the communication keeps through. So we do communicate at least with a referral source, and sometimes we also send it to the patient primary care physicians, so everybody's on board and know exactly what we do.
So ProHab has 2 offices, one in Lowell and one in Chelmsford.
Yes.
You switch dates and times in regards to
we do, but my other office, my partner Tom is working there.
Covers that.
Yes, and Susan Potamitis, who is also a physical therapist. My wife works there for a few times, so we cover that, and I stay in Chelmsford, and I go to Lowell as well.
All right.
So and we have 2 assistants that they're helping us.
Does Chelmsford High School refer students to you, or is that how it's done? I mean, I don't know.
I'm not sure how exactly it works. I mean, it'd be very interesting to explore that possibility. We do get students from Chelmsford High School occasionally referred to us by either the specialist or their primary cares. Both from Chelmsford, Westford, Lowell, but we don't have a direct referring relationship, and definitely that's something that I would like to explore.
Follow up on. Yeah, that's interesting.
Yes.
Yeah, I mean, they should, seeing that you're in town.
Yes.
And that type of thing, because, I mean, there's always football injuries, and there's always,
Absolutely.
some sort of injury in regards to athletics in Chelmsford High School. Yeah. So
if I can open a parenthesis to that, there's also a huge body of evidence that really certain techniques, especially when it comes to the knees, you can really prevent ACL injuries. There are certain movement patterns that they can really predict or put the patients or the athletes in a much higher category to develop an ACL injury. There's a very big body of evidence on that. So prevention it's a big thing. So
maybe they should have you go to and talk to the the football team or the baseball team or whatever team that got to prevent that, and that would be a good end, so to speak.
Sure.
Yeah, I don't know if they have a physical therapist on that they refer to and so forth. But that's in regards to all sports injuries. It doesn't matter whether you're from Billerica High School or Lowell High School or Westford High School. I mean, they could definitely go to your office at 227 Chelmsford Street in Chelmsford. Yes. I presume there's parking there.
There's other parking.
Oh, good.
Both offices have plenty of parking.
Okay, so you can walk from the parking lot into even if you have an injury, and walk into your building. And so
yes.
All right, that's good. That's good to know. Tell me about arthritis. I mean, can you help people with arthritis? Let's say I have arthritis in my back, and I want to come and go to a therapist?
Well, let's define it first. We're talking about osteoarthritis.
Yeah.
Okay, because it's more like a wear and tear of the joint. Because it's the rheumatoid arthritis that is a totally different condition that has to do. It's an autoimmune.
Well, I don't know the
condition.
technical terms.
So basically, what arthritis is a wear and tear of the joint. The joint has a very, very small lining, which we'll call cartilage, that it's very, very well lubricated and decrease the coefficient of friction close to zero. That's why we can live so many years. And then a major problem.
Yeah.
So when this part of a joint start getting destroyed, obviously we create an inflammation, and a lot of that wear and tear is happening because people are not moving right, or the motion pattern is not good. They're stiff. They have decreased range of motion. They don't move properly. I don't know. Sometimes people get like shoulder pain and they lift the whole shoulder when they try to do that. So this is, if you correct that, then you decrease the forces that you put in a specific joint.
We have some pictures about correcting the spine that we're going to put up, and to talk about your being erect and so forth. So I have to sit up correctly.
Exactly.
And you do that at home in regards to, is there anything you could do at home, like lean against the wall and get
I mean, for starters, and again, I mean, I don't want to give any information because I don't want to get anybody, in trouble. But I mean, safely just try to sit up straight and kind of keep your shoulders back, and a lot of times just do like a small chin tuck.
All right, right there on the camera. What's that? It says, "How heavy is your head?"
This is.
Go ahead. Why don't you explain that?
When you talk about arthritis, this is, and these are actually real numbers. So what we see there is what happens as we, start having what we call a forward head posture, and that's something that is unfortunately very common today.
But with the phone, a lot of the kids I notice lean forward to the phone.
Adults too. In the computer and most of our sedentary work. So obviously you can see there that as you're going forward with your head, you start with a head that weighs 12 pounds to weighing 42 pounds. So that weight, gravity never gives you a break. Gravity is constant. So that weight has to be, bared from those joints. So what you're doing essentially to the joints, you're overworking them. So you're accelerating the wear and tear. You're accelerating the arthritis, and that can be very painful.
There's another one. This is key protections. You could. I hope the audience is writing this down or watching this in regards to how you sit. Go ahead. Why don't you talk about this photo?
Yeah, this is a photo that I think, most of us will spend some time on the computer today. Sure, most of us. So this is a photo that really shows how people are supposed to sit. The monitor has to be in front of your eyes. You're not supposed to look up or down. So sometimes you need to put some books. Your hands have to be rested, and your neck has to be straight. You have to sit all the way back to your seat and not slouch like that.
Yeah, you get a special seat. In other words, buy.
I don't want people to start spending money, but sit up straight and sometimes even put a little pillow to support the low back.
Good point.
That can really help.
Some cars have that. You can adjust that where you have
that
little pillow in there. And what's this one? Issues?
This is the same thing. This is for people that basically are working more on the computer. Like if you're using the phone, it's better to use an earphone.
I see.
They're relatively inexpensive. So again, the keyboard and your arms has to be a straight line between your ears, your hips and your shoulder, as you see there. So try to be sitting properly as much as you can. Now, as we were saying before the show started, is that a lot of times everybody is bidding on these patients. You have to have good posture and stuff like that. But the idea is that the brain it's pretty smart. Our brains are smarter than us. So then the brain is trying to be efficient. So if this is efficient way to sit, then that's really something that the brain is going to get you to. So you really need to create the stage, like stretch the front, the pectoral muscles, and strengthen the back muscles. So this is a more efficient way for your brain to sit up.
George, I think you should go to a college. I mean, colleges and high schools and middle schools and tell the kids how to sit up when they're using the phone, because what happens, everybody leans in.
Exactly.
And I think what we should do is start
So be more
being
straight.
erect. But that's what I see. These kids, I mean, they're leaning in, and maybe they should have you come to the schools and give a speech in regards to how to sit properly.
Absolutely.
I mean, that's why we have you here, so we can have the kids learn to sit up properly and erect.
It's amazing how many kids I see that they develop back pain.
You're kidding me.
They're sitting like that. The parents are telling me, or they study like this.
Right.
They study on their beds.
Well, how should they study?
Well, that's the picture that I saw there. I mean, and again, I mean, as a minimum, they should study
Or
at the desk.
have something that is,
Yeah.
you look at it like a stand, some sort of stand that
Some yes.
to read rather than just sitting
Just
down,
go like
hunching
that.
over.
Yes, yes.
Yeah, that's what I'm concerned about now with the phones. Everybody leans in, and that's bad for your posture.
We do see that in the epidemiology. Actually, we do see that a lot of younger kids start developing neck and back pain, because of probably their posture and the way they do things.
Wow.
And it starts early on, and that's what I say to a lot of the kids that I see. I mean, what's going to happen when you're 50 or 60 or 70? So,
Right.
so when I see a patient, that
What
the
you
younger,
should do is show them a picture of somebody 50 or 60, that has that,
I do,
problem.
I do,
Oh,
I do.
You do? Oh, good.
Yeah.
Yeah, that's good, because it's very important to do that.
Yes.
So they could see pictures of that, actual pictures of it. Good for you.
Yes.
I'm glad, George. What happens when you go to physical therapy? Do you I hate to say this, but do you undress it and you put them in a certain, or can you work with the normal civilian clothes?
we have johnnies and shorts
Okay,
according
all right.
to the body part that we need
Yeah.
to address. So we can do the work that they need. So we have that in the office.
Right.
So we do the assessment, and most of the treatment is, as I said, we're manual therapists, and we try to really focus on the problem that the patient has. And we do, we also do some exercise, and I think that's really, if I can say, in the today's healthcare continuum, that's really important. Patients that receive physical therapy, that they feel that they do get the proper treatment. First of all, that they do get, understanding what they do, the complication of the treatment, and generally it has to be like hands-on. Therapist has to really work with the hands-on. If it's just exercises, you can go to a gym and have it. So it has to be like specific for you, and it has to really involve some types of hands-on kind of work to really be able to make those changes.
Is there such thing as bad therapy? Does that mean people that are unlicensed? And
Yeah.
how do you find out if a person's licensed or
Well,
not licensed?
Fortunately, I mean, we all have to have license, and we have to really present them at some point in the clinic,
Right.
so people can see that we're licensed. So I don't think that this is a big problem. I just think that sometimes what patients are telling me, unfortunately, sometimes they feel that the treatment that they receive, they can do it at home. Would try not to do that, and if that's the case,
You're not doing your job if that's the case.
Well, yeah. If you can do something at home, why go to the office
Yeah,
and
right.
do it? A lot of times depends on the experience of the therapist. That's why we try to, as I said, in our case, I mean, most of our people who work are
Is there a
clinicians.
state registry?
Of
that
course,
you
we have a
can check?
license.
Yeah. Oh, okay.
Yeah. You
I
can
see.
check people licenses and stuff.
Yeah.
But generally, they have to be presented, or they have to be in a visible
Oh, is that
place. Both the facility license and our personal licenses.
Oh, okay.
So
It has to be sort of in the public domain.
in the public, when
in the
patients
waiting
come in
room or
the waiting
something
room,
like that.
so it is there.
So watch for that. everyone. I mean,
Yes.
it's-
I don't think that it's a problem most
Yeah,
of the
yeah.
places, but you never know.
Yeah.
A lot of I mostly fear when people try to assume that they are physical therapists, that they're not physical therapists. And I'm like, I am like a physical therapist, and I don't. And we have a very specific training, as I said, and you know, our work cannot be done by other healthcare provider.
No doubt. No doubt about it. No doubt.
And when people, you know, come and tell me, well,